When we're treating and assessing patients with acne, I think the most important thing is to be aware that the earlier you start treatment and the more aggressive you are with treatment, often the better the results. And because acne is a long-term condition, you also need to educate the patients that they have to be in it for the long haul. So it's not a quick consultation where you might prescribe some medication and then that might be the last time you see the patient until their prescription runs out 6 months later. It's important to make a diagnosis of what type of acne the patient has, whether it's a mild comedonal acne, whether they've got early pustular lesions, and obviously if they have more severe acne, if it's nodular or cystic, or if they've got any scarring, that needs to be treated very aggressively and often needs a referral for Roaccutane therapy. So for most of the patients that we're seeing, fortunately, they're presenting quite early with mild disease. And I think it's important not to underestimate the importance of a really good skincare regime and just to look at some basic lifestyle factors. Often when you talk to patients about what their daily habits are and what they're putting on their skin, you can actually just make a few very minor changes and that can result in quite dramatic improvement in their skin, often without the need for medical therapy. If a patient does need medical therapy, however, again, it's important to introduce that sort of thing quite early, whether you choose to use something like Epiduo or Acnatac or one of the newer medications like Aclief. Again, starting medication like that early will give you the best results. But the problem with those sort of medications is they often have quite a lot of side effects and patients sometimes find them hard to tolerate. So my advice would be to introduce them slowly, even if it's only once or twice a week to start with, and then build them up as the patient can tolerate, because they really do get quite good results from topical therapies, and sometimes they then don't need to introduce oral medication. If they haven't done so well with topical therapy alone, or they're struggling to tolerate it, then I would introduce oral antibiotics, but I do try and limit the duration that I have patients on oral antibiotics for, and really try and rely on a good skincare regime and topical medical therapies. But in some cases you do need oral antibiotics or even a referral, as I said before, to a dermatologist for oral Roaccutane. In terms of other things that we might talk to patients about, you can often in conjunction with medical therapy, introduce things like LED light therapy. There are some laser treatments that can be done for acne and acne scarring, but we tend to introduce these after we've got the patient stabilised on a skincare regime and medical therapies. If I was going to give somebody my top 3 tips for how I'd go about treating patients with acne, again, you cannot underestimate the importance of a really good skincare regime. I always like to see my acne patients regularly. I like to see them every 6 to 8 weeks, and part of the reason for that is that it is a longer term illness and we look at it as a chronic condition that patients often have to deal with for a number of years. And I think that if you're seeing them every sort of 6 to 8 weeks initially and then maybe stretching it out to every 3 months, you're checking in with them regularly, you're making sure that they're adhering to their skincare and their medication regimes, and you're offering them some psychological support. And then probably the third thing that I like to do with my acne patients is just introduce them to the other therapies that are available in terms of lasers and light therapies. Now we have that in our clinic, so we're able to offer it to patients in-house, but if you don't have access to that and you've got a patient who you think might need further treatment, I would just familiarise myself with either other clinics in the area or dermatologists in the area that offer some of those additional therapies so that you can provide your patients with a comprehensive treatment offering.